Hello, doctors and team leaders. I have no idea when they're going to play this video, but thank you for coming. Appreciate it very much. Today's big day. As you saw my emails, hopefully you saw my emails. If you didn't, please look at my emails from yesterday. I think this getting together, learning is what takes from good to great, and really investing in ourselves and educating ourselves and learning from each other. If you just take three things from today, you will be better. You implement them, you will be better. If you just take three things today and don't implement them, you won't be better. But if you take three things today and implement them, you will be better on there. I wanted to go over some things on the why behind some of the things that are in the schedule today and some of the things that you've already learned, and really get my thoughts on there. So the number one aspect I will tell you is a success planning. The success planning with you doctors and team leaders. If you went out and you were in private practice and you were going to hire a consultant, or you heard from a consultant on what's best to do, if you have somebody that's not telling you to do a success plan, fire that person. A success plan is important no matter what business you're in. I don't care if you're in the pizza business or if you're in the dental business. Having some sort of roadmap of where you want to head for the next year. Some people do it for 5 years. I think a year is enough, but is important to have that roadmap. Things will change, and you know what? If they change and you don't have a roadmap, it is very difficult to get back onto the pathway to success. So hence why success planning is so important for us and for our teams. We're talking about, a lot of people are talking about accountability and how do I hold my team accountable? Well, expectations is how you hold accountability, and you set the expectation in the roadmap of where you want to head to. That's important for your team to know. Your team wants to follow a vision. This is the vision of where it's headed. So success planning, number one. Number two is the morning huddle. We start the day with the morning huddle. I'm still seeing huddles where standard of care scorecard is not being printed out, and we're not filling out the sheet, the morning huddle sheet, fully. Why do I get crazy about that? Because it is important for us to know how we're treating our patients. We're in healthcare. It is important that we look at that and we measure how we're treating our patients. And ultimately, everybody, the standard of care scorecard is what that does. It is okay if you're not perfect. Nobody's perfect. But it is a good compass to say, where are we heading? How are we doing? And really get your team focused around that. The secondary part of the actual morning huddle sheet that we're filling out is based on people plus systems equals successful business. It is based on the 4 foundational principles of a dental practice: ReCare, AR, treatment presentation, and customer service. If you fail on any of those 4, you will fail as an office. So your morning huddle is actually measuring how we're doing in those 4 things. So it is one of the most important aspects to start your day, because it sets expectations. It shows people how we're doing. That's how you hold accountability. If you're only going over the schedule and I need help here and I need help there and this patient needs this and this and that, it is worthless. You might be organizing a little bit better during the day, but you are not setting expectations and you are not getting your team to understand what they need to do or how they're doing. Therefore, accountability will not happen. A few other things that you've gone over or going to go over. We talked about Iron Mountain and the shredding service going away. This kind of I've got more emails on this. It's not really that big of a deal, everybody. Iron Mountain is a crazy service from a lot of different aspects. They are very hard to negotiate with and very hard to deal with. That's number one. Number two, we need to shred. If you're wondering what you should shred everything. Okay, we're going to get good shredders in there in order to shred everything, instead of just putting into a box where that's at risk. I mean, the risk is somebody comes in, and a thief or something like that, and they get a hold of that box. It's not great. We need to shred stuff. Bone grafting course is coming up. The bone grafting course and the Angel contest is really a bigger story. If you've heard me speak and many dentists speak across the United States, you are going to hear that bread and butter dentistry is dead. I don't know. Can you survive in a dental office? Maybe if you have real high patient flow, you could survive in a bread and butter dentist. But what I'm trying to say is patients don't want that. Patients want to be able to go to a practice and not get everything done, because I love specialists and specialists are important, and we're really driving that in our at D1. But to be able to get most of their treatment done is very important. I mean, if we're not doing the basics of like extractions, anterior root canals, and so on and so forth, bone grafting, laser, these are services that we are elevating the standard of care. Elevating the standard of care means we're at the forefront. Again, I'm going to be speaking to dentists in Omaha about this. I'm going to be at the dental school. We're talking about bringing in, well, they've already brought in Curodont and bringing in laser, and they want to bring in now clinical AI is going to be everywhere in dental schools. Bone grafting is a must. I mean, if you're in a dental school now and you're doing surgeries, you are doing bone grafting, or at least offering the service to everybody. This is the elevation of the standard of care. This is being on the forefront. In doing that, yes, that puts more money into doctors' pockets. There's nothing wrong in saying that. And believe me, tomorrow I'm going to get 15 times more. Oh, Dr. Cerno, what's your, my biggest complaint is I'm not getting paid enough for this. I'm not getting reimbursed enough for this. Great. But then when we go ahead and elevate the standard of care and do something better for patients, and then it's better for the doctor's paycheck, the team's bonuses, and everything else, all of a sudden people are like, yeah, but we're charging the patient too much, or the patient doesn't want to pay that. You cannot have it both ways. I will tell you, Marko Vujicic from the ADA, their data guy, go online, look at his stuff. Dentist salaries are at an all-time low in 2024, all-time. In 2020, it was $207,000 and you took 2 months off. In 2024, it's $207,000. In 2013, to give some reference, it was $267,000 was a doctor's salary. So we have gone down from 267 to 207. Why is that the case? Well, because reimbursements haven't changed, and those doctors are not changing the way that they treat patients. They are not at the forefront. They're not elevating the standard of care. If you elevate the standard of care and you provide services of laser, Curodont, bone grafting, Arrestin, and things that help a patient, I promise you, everybody, you can grow your dental practice and grow it in leaps and bounds. Growing your dental practice does mean increasing your wages and so on and so forth. And I think that's extremely important, okay? Clear aligners is another thing that we go through, and we talk about malocclusion. You won't believe how many offices, I'm glad everybody's honest with me, have said, Doctor, we don't treatment plan malocclusion. We don't look at that. We don't want to send it somewhere else and they pay $5,000. Now they can't do their treatment here. Malocclusion is a problem. If you were in dental school and you were not diagnosing malocclusion, you would have an issue. Some of you have not been in practice long enough to see the results of what malocclusion does. All of a sudden, if you're in practice for 20-something years, you feel really crappy that you've looked at a patient for 20 years go from worn teeth to a restoration or even worse, loss of teeth. You've seen malocclusion in the lower anterior where bone loss is created, now instability where you've lost the lower ants. It is an important aspect to what we're doing. Clear aligners helps with that, and clinical AI and what Clear aligners is doing has grown so much in our industry. So I just harp on it because this is about leading dentistry. This is about providing the best services for our patients, and we shouldn't feel bad about getting paid for that. Now, in regards to getting paid, you're going over some treatment presentation stuff. I'm going to be going over some really quick hitters next week in bone grafting. If we do not have a team, we as dentists do not have a team around us that can educate our patients, establish their trust, get them to understand why they need it and the consequences of not having it, presenting a great financial plan, we are dead in the water. Okay? So we need help in doing this. Right now, treatment plan acceptance and trust in America with dentists is at an all-time low. That does not mean it has to happen in your dental practice. In your dental practice, you have full control how it is. We have dental practices at D1 that are 70 and 80% acceptance rate. 50% higher than what happens in average daily America. Why? Because patients trust, patients are educated on the consequences and the benefits, and they have a great financial presentation. Today, spend time on that and train your team members. You have to look at treatment acceptance every single day. You can't just say, My patient won't pay for this. I can give you examples all over the United States of 100% fluoride, adult fluoride acceptance, 80% cancer screening acceptance, all on 6, all on X cases in the middle of nowhere being treatment planned and accepted at high rates. It doesn't matter if you have passion behind what you're doing, you have a great education system through your team, and a great financial presentation. I promise you, you can get acceptance, which is very important in dentistry. We got into this business to fix people, not to just watch people walk out the door without treatment. It's like somebody going to a restaurant, ordering the appetizer, having a little bite of it, saying, "I'm starving," and then leaving. They come in, they get their teeth cleaned, they want their teeth cleaned, they want to feel good, they want to make sure they keep their teeth. But when we tell them they need something to help keep their teeth for longevity, they look at us and go, "No, I'm not really interested in that." That's weird. We need to be better at that. I need to be better at that as a clinician. So we all need to work at moving that through, and something we need to measure. Hence, it's on your morning huddle. So I appreciate everybody being there. I've talked already too much. But I am very excited about the future of this. Doctors and team leaders, thank you. You have had some really unbelievable months because a lot of you are doing what I just talked about. A lot of you are taking little things from these meetings, as I said, 3 things, and you actually are implementing them to make your practices better. I cannot wait to see what the future holds here in the next month after this meeting. Thank you, everybody.